Hello, my name is Bruce Beauvais. I am the operations manager at Pennsylvania Ambulance and member of the Lackawanna Recovery Coalition. Today, we are here to show you how you can save a life by administering Narcan. The Narcan nasal cartridge is an antidote that can be used to reverse opiate overdoses. In order to use Narcan, we first need to know the drugs that it works on and the drugs that it does not work on. The drug classes that Narcan works with are opiates and opioids. Common drugs in this class include heroin, morphine, and codeine, OxyContin, oxycodone, hydromorphone, MS-Contin, and various other opioids, including fentanyl. Patients requiring Narcan may have an altered mental state. Some patients may be unconscious. Other signs and symptoms that we are looking for are a depressed respiratory rate or lack of respiration. Easily explained, your patient may appear unconscious. Their coloring may be gray, blue, or even purple. Their breathing may be slow to a point where you may not notice if they're breathing or not. These symptoms are an indication that your patient may need Narcan. There are some others that you must be aware of. Pupil response. Looking at their eyes and looking at the black parts of their eyes will indicate whether or not this patient may be an opioid overdose. Pinpoint pupils, or small black portions in the eyes, are an indicator of that opioid overdose. Now, Narcan does not work on other classes of drugs, such as benzodiazepines, like Valium, midazolam, Versed, Xanax, and Ativan. It also does not work on alcohol, spice, or any other related drugs in those other categories. To administer this drug, we must ensure that there are no trauma mechanisms noted to the nose. The nose is how we are going to administer this medication, so any damage to the face or the nose that prevents us from placing this into their nose will not allow this drug to be used effectively. For those who require instructions, every pack comes with its own instructions. To the right, we have large bold print, small instructions that are lettered and numbered. In the center, there's more accurate and more descriptive. And of course, for those who have reading difficulties, there are pictures on the side as well that'll help you with administration. Let's get down to it. To administer the medication, we're going to take our package. We're going to take the corner of the package and we're going to peel the back away. The instructions come with every dose of Narcan. Fold it out if you need instructions. And they appear just like the ones before. The nasal Narcan cartridge has no needles and is not a sharps consideration. It is a 4 milligram dose of Narcan, which is given intranasally, meaning that we must put the applicator into the nose or the nostril of the patient. Simply, with the patient that we've identified that requires this Narcan, we're going to push the nose back. We want to hold the Narcan nasal cartridge in our hands with our thumb on the button. Place the nasal Narcan cartridge up into the nostril until your fingers meet up against the nose. Depress the nasal Narcan sprayer and discard the Narcan. Place it back in its package, and it can be deposited in your trash safely. Ensure that children do not have access to this when you are complete with it. It's important to understand that nasal Narcan is not to be given without calling 911. It's important that 911 and emergency services are contacted because repeated doses of Narcan may be required for the opioid overdose. Upon arrival of the ambulance, you can get additional Narcan given to you by the EMS crew while they're on scene. This is called the Leave Behind program. It will allow you to retain a dose of Narcan for your loved one or family should you need it in the future. Each emergency Narcan kit will come with 2 doses of Narcan. What you can expect from doses of Narcan is the patient may wake up in 2 to 3 minutes after the first dose. If not, a repeated dose can be given. But things to understand: when you administer Narcan to an opiate or opioid overdose patient, that patient may become combative. That patient may also become nauseous and may vomit. Other considerations to remember are if there are any other drugs in the system. Things to do after administering Narcan is place the patient on their side. Drape their arm underneath their head so that they can breathe and drain any kind of vomit or any other fluids that may come. Narcan is a safe drug. If given correctly, it can return breathing and consciousness to an opioid overdose patient. It does not work with other drugs. However, is not harmful should this be given. It has no allergic tendencies and is a safe drug to give, even if you're not sure. For more information on Narcan or naloxone, please visit LackawannaRecovery.org.